As part of NHS reforms to create what's being called a 7-day service, the Chesterfield Royal Hospital has been chosen from more than 70 applicants as one of the 13 pilot sites. This trust will be at the forefront of developing and testing this initiative, with evidence of good practice and successful projects held up as an example that other trusts could follow. To mark the launch of the Chesterfield Royal Hospital's involvement in this momentous project, we were joined by the National Medical Director of the NHS, Professor Sir Bruce Keogh. OK, well, Sir Bruce, thank you very much for joining us here at the Chesterfield Royal Hospital today. Now, there are 13 pilot sites. One of them's here at the Chesterfield Royal Hospital. What's our role in this project?
Well, NHS IQ have chosen 13 pilot sites. Some pilot sites have barely started on this journey, and some, such as you, have made quite good progress. And we want to accelerate the endeavour towards providing 7-day services in the NHS, right through the NHS. And one of the ways of doing that is to really work closely with hospitals that are having difficulty implementing it and those that have tackled some of the difficult problems. And I have to say, I've spent a bit of time with you today in Chesterfield, and I'm really impressed with the progress that you've made, but I'm particularly impressed with the fact that you recognise this as a community-wide problem, and that in our discussions today there have been people from primary care, community care, local government, the CCGs, because the hospital might be central to all of this. But the key of 7-day services is to provide 7-day services for the community. It's not just about providing 7-day services within the hospital. And if I can just make another point, the term 7-day working gets used a lot. I worry about that, because one of the things that should come out of this, if we do it properly and successfully, is support for staff, so that the issue isn't about 7-day working. It's about formalising proper working arrangements to help people get a good work-life balance at the same time as providing really good 7-day services for the community in which those people live.
You've been here at the Chesterfield Royal Hospital all morning to see what's happening. What are your thoughts about the work being done here?
I think the work that's been done in this hospital and in this community is fantastic, and I'll be doing my best to keep in touch with it, and furthermore I will be sending people to see you, to see how you're doing things, just so that they can learn and so that we can spread some of the good things that you're doing.
What do you hope will be the outcome for this initial phase of the pilot programme?
This pilot programme will help to inform a larger piece of work that NHS IQ are undertaking, but that in turn will inform work that we're doing in NHS England to accelerate the uptake of 7-day services throughout the NHS. And we've put a number of things in place in NHS England, so the focus on all of this is around 10 clinical standards to improve clinical care that's offered in hospitals at the weekend. There's a graduated approach to encourage the uptake of that through the standard national contract in the NHS over the next 3 years. The progress towards uptake of these 10 clinical standards will be borne in mind by the Chief Inspector of Hospitals when he visits hospitals on behalf of the Care Quality Commission. Health Education England will consider how well these standards are being taken up, what supervision junior doctors are getting as part of their training at the weekends in their deliberations for issuing training contracts to individual hospitals, because it's quite clear to me that we need to ensure that the next generation of doctors are adequately trained and adequately supported at weekends as well as during the week.
And have you been encouraged by what you've seen and heard here at the Chesterfield Royal Hospital today?
I've been fantastically encouraged by what I've seen today. One of the things that I'm keen for us to avoid is a top-down endeavour that just tells people what to do, because that will just squash the enthusiasm and the innovation that's needed to drive this forward. This has to be driven by people who are delivering services for other people who they seek to serve. And what I've seen here today has been really encouraging. The ideas are flowing, the enthusiasm is bubbling, and I expect to see a lot of progress here over the course of the next 2 or 3 years. So well done.